Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today, in our Conversation with Cancer Expert series, we have Dr. Samir Hadidi, who is Assistant Professor at the Myeloma Center at University of Arkansas, one of the centers that has made tremendous contributions to multiple myeloma over the decades. And we're glad to have him today to talk about will CAR-Ts and bispecifics eliminate transplant for myeloma. Little Rock has been at the vanguard of getting transplants, up and being the major modality of therapy for patients who are eligible. So I'd be very interested to see what Samir thinks about this. So welcome, Samir.
Thank you so much for having me.
So what we're going to start out with, I guess, is just a discussion of where CAR-Ts have been till recently. So can you tell us where you have used CAR-Ts in the last couple of years, and then we'll see where we are today and where we'll be in the future.
No, I think that's a great starting point. We have nowadays two approved CAR T cell therapy in multiple myeloma, and those have a journey, of approval. We have a cell-to-cell and ide-cel, and both of those agents were used in patients at a later stage in their relapse. So those patients got on a median 6 prior lines of therapy, as you can see on the slide. And in the initial studies were single arm studies where patients who have very limited options, if any, got those products. And when they got it, actually, we got really, promising responses that are durable for such patient population. So in the case of ide-cel, the development program was called COMA studies, and the initial study did result in a progression-free survival of around 9 months. Now, this also was associated with a very high overall response rate of 73%, and patients got deep responses, which we call them CRs or better, in around a third of cases. When it comes to the cell-to-cell, it's a little bit the newer kind of kid in the block, the newer CAR-T.